Melissa from NABC's Vetfolio and the host of this Tech Takeover edition of Vet2Vet. The veterinary technician's role in diagnosing and treating canine lymphoma is essential in maintaining animal welfare and the human-animal bond. Joining us today is Jenny Casabry-Fisher. With her VTS in oncology, she's the perfect person to talk to about the ins and outs of how veterinary technicians can be an important part of the diagnosis, client education and guidance, and just overall support when facing canine lymphoma. Hi, Jenny. Thank you so much for being here today.
Hi, thank you so much for having me. There's absolutely nothing I like talking about more than canine cancer, so you picked a good topic.
Let's jump right in and talk about canine lymphoma. What are some of the common presentations of canine lymphoma? Can you tell us how it's typically caught and diagnosed?
Absolutely. So we know that the incidence of canine lymphoma is reported to be around 24 out of every 100,000 dogs. And we know that all of the dogs that present with canine lymphoma, that about 80% of those present with what we call multicentric lymphoma, which is their peripheral lymph nodes are all enlarged. That's a very large percentage of the overall amount of cases that present in that anatomic way. So, in that one or that area or locations in the body. In other species, we see them present very differently. So, that's why it is so significant when we talk about canine lymphoma, because such a high representation presents in one specific way.
Okay, and you said that presents by being able to actually palpate or see a difference in the lymph nodes, correct?
That's correct. So we will see enlargement of these lymph nodes on the outside of the body. You know, there are multiple lymph nodes throughout the body, but there are some sets that we can actually feel even on a normal dog. The ones that we talk about are the ones behind the mandible or the submandibulars, the ones in front of the scapular or the shoulders or the prescapulars, and then the ones on the back of the knee, which are our popliteal lymph nodes. So all of those are going to be the most common that we feel enlarged with that multicentric presentation.
Right. And you said that it's about 80%, so that's a high number. So I know that owners a lot of times will notice bumps on their pets and they'll ask about it and they'll have ideas about, oh, I think it's getting larger because of this reason and that reason. So, of course, being a veterinary technician, a big part of our job is client education. How can we not only help in diagnosing canine lymphoma, but also empower owners to look for signs at home? And this isn't just for somebody with a VTS in oncology. This is for general practice technicians too, right?
Oh my goodness, that's an excellent question. So, empower our pet parents, right? They are invested. If they are bringing their pet to you, they love their pet and they are invested in that healthcare. So, get them involved. Technicians, specifically, when we talk about the diagnosis and staging and treatment of this disease, always our veterinarians are going to make that diagnosis. But what we are able to do is gather them all of the tools, especially the diagnostic tools and something like cytology, for them to be able to make that diagnosis. Cytology is a huge one. This is something where veterinary technicians can truly set themselves apart. Cytology is one of those topics that, kind of like cancer, people are like, I know it's important, I know I need to do it, but somebody else do it, kind of thing. And once you get comfortable with those cytology skills, it's something that you realize you can do quite well. A lot of times you can help educate the rest of the hospital as well on some of those tasks. And it helps with the pets in the long term because you're assisting in helping to have that earlier diagnosis with something like lymphoma.
Absolutely. And I think most, if not all of, credentialed veterinary technicians practiced FNAs in school. I know I did them a lot when I worked in the shelter, but I actually have never done one in general practice. And I think that in a lot of general practices, we're used to just having the veterinarian do it.
Yeah.
So once lymphoma is suspected, and we know that we want to do that fine needle aspirate, of course, getting a good quality sample is so important. So, what are some tips for making sure that we're collecting a great sample that's diagnostic?
You are loaded with the good questions. So, diagnostic sampling, I tell technicians, that's your only goal. right? As technicians, you're not here to make a diagnosis. You don't even necessarily have to know exactly what you're looking at. But what you can do is know that what you're looking at is of quality and that there's substantial enough cellularity there for a veterinarian or a pathologist to make that diagnosis. So it's a very easy step-by-step process. I teach it almost like we would teach CPR or anything else. It's kind of a step-by-step skills process. And once you walk through those skills, doing that evaluation for diagnostic quality is easy. And it's something that every time I teach it, people go, why wasn't I doing this all along? Kind of thing. It's one of those things that I think people are scared of. And then once they get in it, they go, my goodness, this helps so much. And I wish I would have learned how to do it sooner.
So once we create that smear, how can we assess it to make sure that it has good diagnostic quality?
So the step-by-step process that I teach is very easy and straightforward. So first you're going to stain that slide, right? Using Diff Quick, whatever you have in the hospital. And then you're just going to kind of walk through the step-by-step process. And it's one, are there cells there? Do you see cells on the slide, right? It's a yes or no question. If it's no, it's obviously non-diagnostic. If you see yes, you kind of follow that down the next set of questions. Is there blood contamination? Do you see blood cells? It's either going to be a yes or no question, right? Then, are there any other cells besides blood, right? And it's important to know about that blood contamination because of certain things we aspirate that may tend to bleed or be in areas that may bleed. So there's a reason that we ask that too. And then, are there cells? Are there red blood cells? Are there other cells other than the red blood cells? Are they intact? Can you see the cellular borders? And are they plentiful? Meaning, do you see more than 20 per high power field? If you walk through that step-by-step process, yes to yes to yes, 90 to 95% of those slides are going to be diagnostic. The thing that technicians have to get comfortable with is identifying those normal structures, right? So they can say, yes, that cellular wall is intact, or no, that looks like a squished cell. That might not be as diagnostic. Those are the techniques that they have to learn about. It's not necessarily what am I looking at, but what is the integrity? Is the integrity there? Is the structure there? Is there a sufficient amount for a pathologist or a veterinarian to make a call?
My gosh, you almost make it sound easy. I'm like, this is something
It's
that
so
I have
much
found
fun.
very intimidating, but I
Oh,
love that process of just sort of eliminating
yeah.
things. Yeah.
And anytime you teach something that's overwhelming, right, to keep it kind of straightforward, to make it not seem as intimidating, and it really isn't. I love teaching it.
That's awesome.
Yeah.
So, once a positive lymphoma diagnosis has been made, what are the treatment options?
So historically, when we look at cancers, the way that we decide how they are going to be treated is based on a systemic versus a local type therapy. So a local therapy, meaning it's just in one location, we're going to use something just to treat there. Systemic, meaning we're going to give a treatment that's going to treat the entire body. With lymphoma, because there are so many lymph nodes in the lymphatic system throughout the body, that's going to require a systemic type of treatment. The most common systemic treatment that we see in human medicine as well as in veterinary medicine is going to be IV chemotherapy. The chemotherapy protocol we see most commonly is something that is abbreviated with the letters CHOP or CHOP. And those actual letters stand for the name of the drug that is in that protocol. So it's an alternating drug protocol. And the reason that they tend to do that alternating drug protocol is because different cells are going to be in different phases of the cell cycle, right? So you have drugs that are cell cycle specific or non-cell cycle specific. And that's the thought process behind using those targeted therapies because they're targeted on a specific area of the cell cycle or phase of the cell cycle.
Sometimes heading straight to an oncology specialist isn't an option for various reasons. Laverdia CA1 verdinexor tablets is an option we've been hearing a lot about recently. Can you tell us about Laverdia CA1 and why this might be a route that owners decide to go with?
Yeah, I am super excited about this. And the biggest reason why is because when we look at the numbers of referrals that we see in the veterinary hospitals or in the academic institutions, only about 10 to 15% of overall cancer diagnosis has actually come from referral. So there is this very large population of 80 to 90% of these cancer diagnoses out in the world that these pets aren't receiving some type of therapy or aren't going for a referral to a specialty hospital or to see an oncologist. And the reasons typically are cost. Pet parents, it's economically not in their wheelhouse. Or the distance, location. It's not feasible with time, kids, life, jobs, things happen, right? And if you're 5 hours away from the closest facility and those treatments are daily every day for a month, taking off work for a month, I mean, it's not feasible in a lot of households today or in the past or potentially in the future. So it is a huge grouping of pets that we have missed with our traditional therapies. And Laverdia CA1, the verdinexor tablets, brings an option to that huge set of population of pets that we haven't been able to reach before. The reason that we can reach that cost, right? We see a much lower cost where we talk about that CHOP therapy for about an 80-pound dog. You're looking at about $2,500 to $5,000 a month. To treat that same size dog with Laverdia CA1, you're looking at around $300 to $400 a month, right? For the medications themselves. So there is a huge price difference as well as the time commitment. We do know that CHOP, that alternating drug protocol, is considered the standard of care, and it is. We see fantastic results with it. We can see prognosis from, I've seen patients 2 to 4, even 5 years post-CHOP therapy. So it's we're not taking away from the benefit of chemotherapy and what chemotherapy does. But we do realize that chemotherapy is not an option for every family. And there is that large subset of that 80 to 90% of patients that aren't going for any type of referral. So bringing an option into their primary care facility, a medication that's given orally at home by the pet parents. So they're spending less time at the hospital, going back and forth to the hospital, as well as just the cost overall is going to be less. So it's an exciting option. I've worked in oncology medicine since 2002. And so it's always exciting when you see products, and we haven't seen a lot of them over time. So it's nice to see something new and fresh, and that's a specific targeted therapy, right? So, not to just have a medication that can affect all types of cells, but a very specific and targeted type of therapy, which is pretty neat too.
Yeah, that is. And you're right. Chemotherapy is, of course, a huge commitment. I didn't realize that you said only about 10 to 15%
Yeah.
of people that are pursuing
Yep.
referral. And so, of course, a lot of people opt for supportive care, which is valid, but I love that this is another option to prolong their life and their quality of life.
Absolutely. And that's, I do want to say too, we talk about chemotherapy being the standard of care, but there is also a lot of kind of preconceived notions. Perception is reality, right? So everybody's own perception of maybe their thought process on chemotherapy, maybe they've had a family member, maybe they've been through chemotherapy themselves. And so their perception of what they might be putting their pet through is real to them, right? And so it's important that we also, and I wanted to communicate this here as well, that we know that about 80% of people that receive IV chemotherapy have some type of life-altering side effect, whether that's vomiting, diarrhea, hair loss, lethargy, anorexia, all of those things that we think when we hear the word chemotherapy. In veterinary medicine, we see less than about 7 to 10% of patients have those same side effects. Now, doesn't mean that can't happen, and it doesn't mean that they don't, but we use doses that are not near as high. We're also not trying to treat these pets so that they live an additional 30 or 40 years, right? And you nailed it when you said quality of life. And that is what is important. It's not about the amount of time, right? But the amount of good quality time that we can offer them. And I think that Laverdia CA1 does a really good job of that as well, because you have kind of and I hate to use the word band-aid, but you have a treatment that you could even use in the interim, right? Let's say the pet is diagnosed with lymphoma. Mom and dad are in complete shock. Their perception is reality. They're freaked out. They just went through chemotherapy. They need to think, right? Now we have an option that we say, okay, here, take this with you, go home, and you have some time to think, right? We know that lymphoma is an extremely progressive disease. So giving 24 or 48 hours can sometimes be life altering for that pet. So at least being able to say, here's something, take it home. You do potentially have a little bit of time, but let's go ahead and start getting something working while they're making that decision. So it can kind of, I don't want to say buy a little time, but it certainly is something we haven't had to offer before, which is very, very exciting for these pet parents and these pets.
Yeah, I love that. I love that it can be used kind of as its own standalone treatment option, or like you said, kind of a bridge until they can get that appointment for referral or decide if that's something that they want to pursue. That's very cool. So Laverdia CA1 has conditional approval, that's the CA, by the FDA.
Mhm.
Can you explain what that means and why it's important for veterinary technicians to understand the implications of conditional approval?
Absolutely. So, conditional approval for a medication means that it has been deemed safe by using the label recommendations, and that it has a reasonable expectation of effectiveness. So, basically, we're waiting on more studies, right? More data to move to that full approval. For conditional approval as well, Laverdia CA1 is only used in dogs and for lymphoma specifically. So only dogs, only lymphoma, and that's kind of what envelops all of that conditional approval.
Okay. Yeah, I like that. And I do think that's important for technicians to understand because I'm sure that they're going to get questions, right? Like, well, my friend whose dog had cancer used this. Is this an option for me? And they can sort of troubleshoot those questions right away if it's not an option for them.
Absolutely. And Dr. Google can be our best friend, our worst enemy, depending on the day. So it's absolutely vital that veterinarians and veterinary staff members know what that conditional approval means, and that this drug is only for dogs and only for dogs with lymphoma.
Right.
And let's take a moment to mention some of the side effects associated with Laverdia CA1. The most common reported adverse reactions in dogs include anorexia, weight loss, vomiting, diarrhea, lethargy, polyuria, polydipsia, elevated liver enzymes, and thrombocytopenia. Owners should stop Laverdia CA1 immediately and contact their veterinarian if they notice any of the following changes in their dog: refusal to eat for more than 1 day, repeated vomiting or diarrhea, lethargy, or if their dog experiences any other changes that concern them.
So Laverdia CA1 is not chemotherapy, but there are strict safe handling guidelines for this medication for both veterinary staff and clients. Can you elaborate on what those guidelines are and how we can address this with clients?
Yeah, safety is always going to be at the forefront. Anytime we're dealing with a medication that could potentially have any type of adverse event or adverse effects, it is going to be recommended that you're going to wear chemotherapy approved or chemotherapy safe gloves when handling. So support staff, if they are handling, the majority of the time they might not be handling because it's going to be in a sealed closed bottle, right? So the reduction of that handling will be there. It's going to be the pet parent once they get home. And unfortunately, when we look at regulations and guidelines that are out there in the world, there are no set specific handling guidelines for pet parents administering chemotherapy or drugs that may have some of the same potential adverse events as chemotherapy. There is no regulations or guidelines. So what we have to do is refer to the package insert and refer to that as our guideline for handling. And so with Laverdia CA1, you're going to use those chemotherapy approved gloves, washing your hands before and after use, keep out of reach of children. So we obviously don't want this anywhere where a toddler or a young child or even a pet can come along and get access to this type of medication. So out, away from general population, handle it with gloves, and then dispose of that empty bottle. You can certainly take that back to your veterinarian's office and they can dispose of that for you.
And another safety note is that pet owners should wear gloves when handling their dog's bodily waste or fluids.
And it is a tablet, correct?
Yes, you are right. And they actually went a little step further and actually changed the color of each tablet based upon the milligram dose. So, really nice to be able to identify what dose it is based upon the color of the pill. As far as handling those as well, you're going to wear those chemotherapy safe gloves, and we're not going to do any crushing or splitting of those pills. Those pills should stay intact for delivery. No splitting, no crushing at all.
I love the idea of extending the amount of time a beloved dog with lymphoma doesn't know that it's sick. So much of the human animal bond is built on the owner's dedication to doing what they can do to make sure that their pet has a good quality of life, as we talked about earlier. How does Laverdia CA1 give the pet owner and the care team another option to foster the human animal bond?
It's huge. It's that this 80-90% of people and their pets who haven't had potentially an option before. It takes that time and travel and distance, as much as they would have to travel for IV chemotherapy out. And it also takes as heavy a burden of cost off of their plates as well. One of the studies that actually looks at patients or pet parents that go for referral, those that don't, the majority of those pet parents that didn't go referral also stated that they wish they had another option, right?
And that's what I was thinking as you were mentioning that. It's just that I know that a lot of pet owners have a lot of guilt in these situations.
100%. Well,
Yes.
we all love our pets. Our pets are our entire world, right? And to have to make a decision based on what you want to do, but what you can do based upon an economic reality is very, very difficult. And so, like I said, just to have something to give these pet parents is amazing.
So I find this really interesting. I think that, like myself, a lot of veterinary technicians kind of only know the very superficial layer of what oncology entails. So, for other veterinary technicians interested in maybe a VTS in oncology and making an impact in the world of treating companion animals with cancer, what advice would you give them? What is a little bit of what that process is like?
Oh my goodness. The process for VTS is certainly not an easy process,
Yeah,
but it is certainly worth it. I think the one tidbit of advice I would give veterinary technicians as far as cancer cases go, well, I think there's two. You can utilize yourself more than you think you can. There are skills that you have that we use specifically with these cancer cases that are vital. And second, that cancer is a chronic disease. Cancer is not a death sentence. Cancer is just like diabetes, Cushing's disease, Addison's disease. It's this disease that's going to take this long-term management. So I think if we approach it a little bit differently, I think that one, our patients are going to get better care. And I think people are going to be a lot more interested in some of these cases just because it may take that approach and a little bit of that fear out of it, thinking about it as it's another diabetic dog. And see I would rather run into the building on fire, screaming, than managing a diabetic case. Like diabetes is terrifying to me.
yeah, it can be.
But just a different chronic disease to manage long term, which really utilizes veterinary technicians.
I love that. And like you mentioned, with treatment, sometimes they can live 2, 3, 5 years longer. So, yeah, you're absolutely right.
Yep. Well, and people when they talk about cancer, they always get stuck on lifespan, right? They're like, oh
Sure.
well, prognosis is only 3 to 6 months, and that Great Dane with an osteosarcoma. Well, let's look at that because that Great Dane is now 8 years old of a 9-year life expectancy. So that 3 to 6 months, out of that only year left of life, when you look at the math on that, that's actually a pretty distinct time. It just seems really short on human life expectancy timeframes, right? So I think that's another topic. We have to educate veterinary technicians and pet parents that, we talk about 1 to 2 year survivals and they go, oh, that's just not long enough. Well, I agree. It's never going to be long enough, but in your pet that's only supposed to live 12 or 13 years as a normal lifespan, that additional 2 years is actually quite a long time. So it's all about kind of retraining and refocusing how we kind of educate ourselves, our peers, and the public on some of these matters.
So we have to have you back to talk about FNAs and cytology smears, and we have to have you back to talk about quality of life issues and
Because
treating it
I
as a chronic
hate to
disease.
talk about cancer, obviously. I hate it.
I'm excited about both of these talks. We need to make it happen.
I would love to.
Jenny, thank you so much for joining us today.
Oh my gosh, you're so welcome. Thank you for having me. It was an honor.
And thank you to DECRA for partnering with us for this edition of Vet2Vet. Check out vetfolio.com for more of our Vet2Vet discussions on various topics in veterinary medicine. And remember, great patient care starts with self-care. Important safety information. For use in dogs only, Laverdia CA1 verdinexor tablets is conditionally approved for the treatment of lymphoma in dogs, not for use in humans. Keep this and all medications out of the reach of children. Children should not come into contact with Laverdia CA1. Pregnant women, women who may become pregnant, nursing women, and children should not handle or administer Laverdia CA1 or come into contact with the feces, urine, saliva, or vomit of treated dogs for 3 days following treatment. Laverdia CA1 can affect male fertility based on animal studies and studies in humans. Wear protective disposable chemotherapy-resistant gloves when handling Laverdia CA1 to avoid direct exposure to moistened, broken, or crushed tablets or biological waste from the treated dog, feces, urine, saliva, or vomit. Do not use in dogs that are pregnant, lactating, or intended for breeding. Laverdia CA1 is a possible teratogen and can affect female and male fertility. Dogs should be frequently monitored for hematologic and serum chemistry abnormalities. The most commonly reported adverse reactions in dogs includes anorexia, weight loss, vomiting, diarrhea, lethargy, polyuria, polydipsia, elevated liver enzymes, and thrombocytopenia. Please see package insert or visit decra-us.com for full prescribing information.